Hi there. I wanted to take a minute to let you know that you are normal. And what am I talking about? I'm talking about medical stress or anxiety or panic or even PTSD. Many of you have been there before, or a loved one has been there, unfortunately, in the ICU due to an injury, an accident, surgery gone wrong, or critical illness. Obviously, we are in the era of COVID. But today was a sort of a stepping stone for myself as a former emergency medicine physician. I have a bit of dread or trepidation when I have to go to the hospital as a patient, essentially. So this is the first time I've been into the operating room since my aortic aneurysm surgery in 2017. And honestly, I have a little bit of PTSD symptoms, and I wanted to share that in terms of the fact that it is relatively common and can be normal. And there's a variety of reasons for that. Obviously, the stress of an ICU stay puts a tremendous demand on the body, not only physically, but mentally, psychologically, spiritually. It sort of ticks all the boxes in terms of major stressors, and just depends on what the illness was, the length of the stay, a variety of factors, including medications, side effects, procedures, sedation, infection, fever. So many factors go into that. It's very common among caregivers, particularly ICU nurses and other caregivers that work in the ICU setting on a regular basis. And there's a variety of reasons for that, as I alluded to as well. It's not necessarily that these are delusions, but oftentimes it is a result of altered perceptions of an ICU stay. The memories aren't as accurate as the patient perceives them to be. I have many memories that feel very real, and I'm confident in their validity, but when I talk to friends and family members that were there with me, they paint a little bit different picture or story, sometimes better, sometimes worse, and so it just depends on the flavoring of the cook, so to speak. But you are not alone. It's not abnormal. For example, today, completely calm, relaxed, ready to go, and got there, got hooked up, IV in place. And as I'm wheeling down the corridor to go into the operating room, it just took me right back to 2017. Unfortunately, when I turned the corner in that setting, the number of ICUs in the facility was massive. It was like going down, I liken it to an airport terminal where it's just endless gates, just nonstop, like in a major airport like Seattle or Atlanta, Hartsfield, Jackson. So fortunately, the ride was short. The anesthesiologist was great. There was music going, and the staff were super friendly. And I think he probably sensed a little bit of my trepidation as we had talked about some of the preceding ICU and critical care experiences I had as a patient, and so perhaps a tiny bit of ketamine on board, which he told me he was going to use, and so that sort of took the edge off. But I am now about 3 hours post-procedure, fully recovered, other than being a little bit groggy and hazy from the anesthesia, and obviously sitting in my home office. So I just wanted to share that with you, that you are not alone. It's normal. If it's something that really is hampering you on a variety of fronts in your life, I certainly encourage talking to somebody, getting care. There's a variety of options out there. This, again, isn't medical advice, but there is telemedicine, telecounseling, therapy, depending on the degree of it is. I know patients that have had critical illness, and they absolutely now avoid doctors at all costs, despite some underlying health problems that really should behoove them to seek routine care on a regular basis. So I hope you found that helpful. If you haven't checked out my Healing the Heart course, you can find it pretty much everywhere. It's on YouTube, it's on Udemy, it's on Thinkific, it's on Gumroad, a variety of places. It's completely free. It just talks about what it's like to prepare for and go through a major cardiac procedure, including ICU stay, and some thoughts on recovery. So as always, have a fantastic week. Be safe, be well.